Now, the Roche organization is one that focuses on finding new medicines and diagnostics and utilizing database insights to evolve the practice of medicine and help patients live longer, better lives. The organization is currently hosting, that is the Roche Africa Press Day. It's a conference under the theme Women's Health Equity. The event also offers a platform for knowledge, engagement, and solutions on women's health with the ultimate aim of promoting sustainable healthcare models for the benefit of patients. Now, joining us with insight on what the attendees can expect at the two-day conference that is currently taking place at the Century Conference Hall in Cape Town is Maturin Chomi, Roche's Pharma International Area Head for Africa. A very, very good morning, Mr. Chomi. How are you doing?
Good morning to you, Nicole. Doing well, and thank you for hosting me today.
We're really, really happy you could make time for us. Now, getting into the swing of things, I think maybe we can start with you briefly telling us about how the Roche Africa Press Day came about.
Roche Africa Press Day came from an observation that it's important that we involve media in the conversation around healthcare, because we see media having a key role in other parts of the society of our lives, such as finance, agriculture. But the voice of media in healthcare is less what it should be. That's why we came out with this concept of bringing media and key partners who are doing lots of things to improve healthcare together, so that they can discuss the issue around healthcare, but also share view on how to solve them.
Thank you, Mr. Chomi. Now, the day obviously seeks to also educate women on the importance of their health, as well as share very critical information that empowers women to have a voice as well. Now, what are the most pressing challenges currently facing women's health on the continent, and how does, this day aim to address challenges such as these?
Anyone can have poor health, but poor health affects African women inequally. If I take the case of breast cancer, for example, in Africa, 5 in 10 women diagnosed with breast cancer will die in 5 years. This is in a very sharp contrast with what you will see, for example, in Europe, where 9 in 10 will still be alive in 5 years. Or for African women in the United States, where 8 in 10 will still be alive in 5 years. So it has therefore become very important for us to bring this type of conversation in the open, not only in the doctor rooms, but also for people like media who can influence understanding of the challenge, to talk about it.
Yeah, most certainly.
For example, we all know that every year 19,000 maternal orphans are created. This is what we want us to come together and discuss over the next 2 days here. The impact that such situation can have on the economic, on the society.
Let's also talk about, you just spoke about the impact there, very important, but I want to ask if you can highlight any innovative solutions or programs that Roche is, implementing to improve women's health outcomes on the continent.
Let me start by saying Roche is not the only one doing that. I think we have to recognize that there's a multiple partner on the continent who have really taken the question of women's health seriously, and we can see a lot of things happening. We at Roche, over the past years, in multiple countries, have been creating partnership with local players in order to address these challenges in health situation that women face. A good example that comes in mind immediately is what we have in Kenya going on, where with the National Cancer Institute, which is a government body, and Savannah Technology, which is a technology company building data platform, we came together and put a private-public partnership in place in order to digitize all the information around women and breast cancer. Because if this data become available, policymakers will now have informed information to make the decisions that are required so that women are taken care appropriately. That's one example. The other example that come in mind is the work that we are having with the Unjani Clinic network in South Africa to make sure that those women showing up in the clinics in the township have the opportunity not to talk only about what is bringing them to the clinic today, but also the importance of think about their health as women more holistically.
For certain. Now, we can't operate in silos or operate on an island, and therefore, our stakeholders are very, very important. How does Roche engage, with local communities, if we're speaking about the local communities, to understand their specific health needs and also to tailor-make programs accordingly?
Nicole, you're touching on a very important point there, right? Because one of the really root cause of the situation we have in the women health in Africa today is also what happened in the communities, such as some cultural myth, for example, right? And therefore, if we really want to address the women health challenge holistically, it's critical that we also go at community level to start, in one hand, making broader education, but also making broader sensitization of the community leader. And this is exactly one of the reasons why we are bringing the press this week together, because we know that the reach of the community by the press, if you take, for example, digital press, for example, it's much broader than what we as an organization can do. Hence, we want in situations like this to team up with some digital media to bring the education and the awareness on women health issues to the community. For example, in some countries, such as Ghana, we are working with community leaders or media to educate and sensitize women on the necessity to do their mammography so that they can know whether they have breast cancer earlier enough. Because science has shown that if breast cancer is caught earlier enough, the outcome is much better. Therefore, education in the community level, engagement with community leaders are critical way of also improving the women health outcome.
Mr. Chomi, I wish we had a time, but because there's so much that I really want to ask you, but I really want to touch on, if we talk about innovation and data or research, rather, but how important is research data in shaping women's health policies on the continent? And at the same time, maybe you can just wrap up for us in that vein.
That's an important point. I think today, one of the reasons where women health is where it is that we don't have a good understanding of the situation. That we're investing in technology and data to capture the information around the women journey in the society will help us understand the full extent of this situation. For example, again, one of the things that we are doing in some of the country, as I called the case of Kenya earlier, is to work with technology organization to build platform that allows in the institution when women shows up to have concrete data, for example, of where about they stay, what has been their medical history, what are the type of challenge that they are facing, because by pulling those data together, we will be able to drive insight, as I mentioned earlier, that would allow policymakers to make the right decision in terms of prioritization, financing, and focus.
Thank you so very much for your time. We really appreciate the insight there, Mr. Chomi, and all the best with the rest of the conference. We wish to engage you again in the future.
Thank you very much, Ika. It was my pleasure.
Bye-bye. There you have it, Namibia speaking to the international area head of Africa for Roche as they are organizing or currently hosting, that is the Roche Africa Press Day Conference in Cape Town under the theme Women's Health Equity. Quite a lot that came through from that conversation, but we have a lot more. We are headed into the last hour of the show, so there's a lot more coming up. Please stay with us.